All right, so you've been digging into surgical treatments for anal fistulas.
Yeah.
It's not exactly light dinner conversation,
Yeah.
but you never know when this knowledge might come in handy.
Yeah.
And you shared a really dense academic paper with us
A network
on
meta-analysis.
network meta-analysis. That's right.
Oh, yeah.
And today, our mission is to break down the key findings so you can understand the latest research without needing a medical degree.
Yeah.
But first things first, what exactly is an anal fistula?
Well, it's an abnormal tunnel that forms between the anal canal, the very end of your digestive tract, and the skin around the anus. You can think of it like a rogue passageway that shouldn't be there.
And I imagine that can cause some pretty uncomfortable problems.
Absolutely. These fistulas can lead to pain, swelling, bleeding, and even discharge. They can really disrupt your daily life. And to make matters more complicated, there are different types of fistulas. A simple fistula goes straight through, while a complex one might have multiple branches or involve more of the anal sphincter muscle, which is the muscle that helps you control your bowel movements.
So I'm guessing that makes treatment a bit tricky.
Yeah, it does. The goal is to heal the fistula completely so it doesn't come back.
Right.
But you also want to preserve bowel control.
Makes sense.
Yeah.
Nobody wants to trade one problem for another. The study mentions a procedure called fistulotomy, which I'm guessing involves cutting the fistula open.
Yeah, you got it. It's basically opening up the fistula tract to allow it to heal from the inside out.
Okay.
And while it can be effective, it can also increase the risk of damaging that important sphincter muscle, which can lead to incontinence.
Right.
That's why researchers are constantly looking for other techniques that can heal the fistula while protecting that muscle.
Okay, so that brings us to this network meta-analysis you've been digging into. Can you explain what makes this kind of study so powerful? It sounds like a superpowered literature review.
Yeah, it's exactly that. It's a way to combine data from many different studies to get a much bigger picture of what's working.
Okay.
Imagine trying to understand a puzzle by only looking at a few pieces at a time. A network meta-analysis puts all the pieces together, giving you a much clearer view of the whole picture.
Right.
In this case, they looked at 52 randomized controlled trials. That's a lot of puzzle pieces. We're talking over 4,000 patients, which gives this analysis some serious statistical muscle.
So after putting all those pieces together, what did the researchers find?
Mm.
Was there one magic bullet treatment that worked best for everyone?
Unfortunately, no. The results were a bit anticlimactic in that no single surgical technique consistently outperformed the others when it came to overall healing rates.
Really, all that data and no clear winner. So what does this mean for people dealing with anal fistulas? Does this mean there's no hope?
Not at all. While there wasn't a clear winner in terms of healing rates across the board, there was one really interesting finding that stood out. Remember how we talked about the importance of preserving bowel control?
Right.
Well, the study did find that a technique called LIF, which stands for ligation of the intersphincteric fistula tract, was the best at minimizing the risk of incontinence.
Lift T. Okay, that sounds promising. Can you explain what makes this technique different?
Yeah. Imagine a leaky pipe under your sink. With lift surgeons essentially tie off the fistula tract with a suture, similar to how a plumber might clamp off the leaky section of a pipe. Then they remove any infected tissue, allowing the area to heal cleanly. Because it's less disruptive to the anal sphincter muscle, it tends to have a better track record for preserving normal bathroom function.
Yeah, it's amazing. So even though Lift T might not be the fastest healer, it could be a game changer for those worried about incontinence. What about all the other treatments this study looked at? I know you mentioned some pretty interesting ones.
Oh, there were quite a few. They looked at everything from collagen plugs, which are kind of like a biological sealant, to fibrin glue, which acts like a surgical adhesive, and even stem cell injections, which are still in the very early stages of research.
Collagen plugs, fibrin glue, it sounds like a crafting project gone medical.
You're not wrong. But while these newer techniques are definitely fascinating, many of them were only evaluated in a single trial within the analysis.
Hmm.
It's like trying to judge a recipe based on one person's review. You need more data to get the full picture. More research is definitely needed before we can draw firm conclusions about their effectiveness compared to more established techniques.
That makes sense. It sounds like this meta-analysis, while incredibly helpful, also highlights the need for more research, especially when it comes to these newer treatments.
Absolutely. And there's another layer of complexity we need to consider, which brings us to one of the limitations of this study.
Okay, I'm all ears. What else do we need to keep in mind when interpreting these findings?
Well, one of the challenges with comparing all these different studies is that there wasn't a consistent way to classify anal fistulas. It's
Okay.
like trying to compare apples and oranges.
Right.
Some studies might define a complex fistula differently from others,
Yeah.
making it hard to know if they're really talking about the same thing.
So even though they gathered data from 52 studies, it sounds like the lack of standardized definitions might make it hard to draw really strong conclusions.
Exactly. It's like trying to bake a cake with a recipe where everyone's using different sized cups and spoons.
Right.
You might end up with something edible, but it might not be what you expected.
That's a great analogy. It sounds like the researchers are calling for more consistency in how fistulas are categorized so we can better compare the effectiveness of different treatments.
Yes, that's one of their key recommendations. Standardized definitions and outcome measures would make future research even more valuable.
Okay, so we've got this incredible amount of data, but we also have to be aware of the limitations. But even with those limitations, this study is still offering some valuable insights, especially when it comes to the lift technique.
Absolutely. And it's important to remember that for someone facing this condition, the prospect of incontinence after surgery can be a huge concern. So the fact that lift seems to minimize that risk is a big deal.
It really highlights the need for surgical approaches that not only address the fistula itself, but also prioritize the patient's quality of life afterward.
Right.
I mean, what good is a successful surgery if it leaves you with another problem?
You're absolutely right. And that's why this study, despite its limitations, is so valuable. It gives us a much better understanding of the pros and cons of these different techniques
Yeah.
and helps us move closer to truly personalized treatment plans.
You mentioned earlier that the study specifically excluded fistulas caused by Crohn's disease. Can you explain why those cases were left out?
Sure, Crohn's disease is a type of inflammatory bowel disease, and the fistulas that develop as a result tend to be much more complex and challenging to treat. Think of it like this. If a regular fistula is like a single leaky pipe, a Crohn's related fistula might be like a whole network of leaky pipes, often with a lot more inflammation and a higher risk of recurrence.
So it's almost like a different beast altogether. It makes sense that they would need to be studied separately.
Exactly. Treating Crohn's-related fistulas often involves a multifaceted approach, combining medications to control the underlying inflammation with surgical intervention.
So for anyone listening who might be dealing with a fistula related to Crohn's disease, the findings from this particular study wouldn't necessarily apply to their situation.
That's right. It's important to remember that this research focused specifically on fistulas not related to Crohn's.
Okay, that's an important distinction for our listeners to understand. And honestly, it sounds like a topic worthy of its own deep dive sometime.
I agree. There's a lot to unpack when it comes to Crohn's-related fistulas and the unique challenges they present.
Well, we've covered a lot of ground today, from understanding what an anal fistula is to exploring the nuances of different surgical techniques, and even touching on the added complexities of Crohn's-related fistulas.
And we've done it all without getting too bogged down in medical jargon. It's fascinating how much information can be packed into one research paper.
It really is. And that's the beauty of the deep dive. We take these dense, complex topics and make them accessible and, dare I say, even enjoyable.
I think we've succeeded in doing that today. And hopefully our listeners now have a better understanding of this condition, the challenges it presents, and the advancements being made in treatment options.
Absolutely. But before we wrap things up completely, I think it's worth taking a moment to zoom out from the specifics of this study and highlight a bigger takeaway.
I agree. What's fascinating here is that this research really highlights the ever-evolving nature of medical knowledge. We're constantly learning, refining our techniques, and seeking better solutions for complex conditions.
It's like that saying, the more you know, the more you realize you don't know.
Exactly. And this deep dive has definitely underscored that for me. There's still so much we're learning about anal fistulas, their causes, and the most effective ways to treat them.
And that's why research like this is so crucial. It pushes us to ask better questions, refine our methods, and ultimately improve patient care. It's not just about finding a magic bullet solution, but rather about continually expanding our understanding and working towards the best possible outcomes for patients.
Absolutely. And for any listeners who may be facing this condition themselves or know someone who is, I think the key takeaway is to have open and honest conversations with their healthcare providers.
Right. Talk about the different treatment options, weigh the potential risks and benefits, and ultimately make an informed decision that's right for their individual situation.
Well said. Knowledge is power, even when it comes to topics that might make us a little uncomfortable.
You got that right. And speaking of knowledge, before we sign off, I want to leave our listeners with one final thought to ponder. We've been focusing on surgical treatments, but are there any non-surgical options for managing anal fistulas? And what are their limitations? That's something for you to explore further.
That's a great point. Yeah, there are indeed non-surgical approaches, such as medications to manage symptoms and promote healing, but they often have limited effectiveness, especially for complex fistulas. It's really important to discuss all the options with a healthcare provider to figure out the best course of action for your individual situation.
Absolutely. Informed decision-making is key. So to recap what we've learned today, there's no one-size-fits-all solution for treating anal fistulas. Fistulotomy can be effective but carries a risk of incontinence. While the lift technique seems to be a promising option for minimizing that risk, we also learned that those newer techniques, the collagen plugs, the fibrin glue, while fascinating, require more research before we can make strong conclusions.
Exactly. And remember, this study focused specifically on fistulas that weren't related to Crohn's disease, which tend to be more complex and require a different approach.
Right. So much to think about. This has been a truly fascinating deep dive. A bit outside the usual dinner conversation, maybe, but incredibly insightful.
It really has. And it reminds us that there's always more to learn, even about topics we might not typically discuss.
You got that right. That wraps up our deep dive into the world of anal fistulas and their surgical treatments. You've learned about the challenges, the latest research, and most importantly, the importance of asking questions and staying informed. And that's what the deep dive is all about, empowering you with knowledge. Until next time, stay curious.